So my name is Venkat Iyer. I am a consultant neurosurgeon at Southmead Hospital in Bristol. I also consult at the Solis Hospital in Bath. I am an adult neurosurgeon and I provide both elective and emergency neurosurgery to a population in the Southwest, roughly covering about 2.5 to 3 million, along with 14 of my other colleagues in the department. I lead the brain tumor service in this trust, and I'm also the chair of the brain tumor network for the Southwest, and have been the chair for the last 12 years. About 80% of my elective work deals with brain tumors, the majority of which are brain tumors within the substance of the brain called primary brain tumors. About 20% of my elective work deals with spinal degenerative disease, which is dealing with trapped nerves or compression of the spinal cord or nerves requiring an operation. So I did my medical schooling in India, and I came to the UK and trained in surgery initially, and then did about 10 years of neurosurgical training. So on the whole, had to do about 15 years of surgical training before I could qualify as a neurosurgeon. So I think the thing that really humbles us is the patient contact, and it really is a great privilege to be able to sit down with somebody and for them to tell you their story and to share their problems and to make you part of their life for a period of time. And that is such a privilege. And I learn a lot from my patients. So you listen to a lot of patients and their carers, and most of the problems that you think are really big for you completely go away in the face of what other people are facing and how they are coping with it. I find it really humbling to see a lot of my patients cope with the most difficult problems that they have, not only physically, but emotionally and mentally and socially. And a lot of the people just cope with it. They are so optimistic. They keep smiling at you. They keep thanking you. And that is just so humbling and such a great privilege. I think the one thing that we as doctors, as surgeons, and all of us probably try and we forget as we go along is that what is really important is to focus on the person. And it doesn't matter how complex an operation you do, it's still at the end of the day, a life saved or a disease bettered. And one of the really good phrases that we use is care always and treat sometimes. There are many, many conditions where you can't actually treat, where treatment, we don't know what the treatment is too difficult. But what is really important is you care for the person, you care about them, you care to make them comfortable, to make their environments more bearable. And I think that's what really medicine and nursing are about.